is like our first part. We're going to talk about basically tendons, their function, and why the injuries happen to the tendon. And then next week we'll talk about, what do we say? Rehab. Yeah, everything. So essentially, obviously we know that all tendons connect muscle to bone, but understanding that we have tendons that do two different things. We have positional tendons, and I typically think about those as like the tendons for more stabilizing joints, I guess you could say. So supraspinatus, some of the smaller muscles of the foot, those tendons are more for basically like stabilizing, and they're called positional tendons. So they all help to keep basically joints in place, and they're, I would say, almost strictly for just transmitting energy from the muscle to the bone. And then the other type of tendons, which is basically energy storage tendons, they're the bigger, stronger tendons that you think about. So maybe like our lat or our pec, and they are responsible for transmitting energy to the bone, but they also contain storage themselves. And then that's kind of like the main tendons we're going to talk about, because we see, I guess, more tendon strains inside those muscles. So two different things. Those tendons that transmit energy and their energy storage tendons, they allow the muscle to like maintain optimal length tissue relationship for a much longer period of time. So what happens is those bigger tendons like the lat, pec that we talked about, they can actually stretch and allow the muscle to stay in a length, an optimal length tension relationship, so it can perform better than positional, like kind of just are going with the flow of motion, I would say. So what happens is they maintain a more optimal length tissue relationship, and then the tendons, as they release energy, they release it slower. So that gives the actual muscle belly a less chance of strain, because the tendon is taking on much more force, obviously. And I always, like I say, you probably heard me say before too, that tendon issues, every time like people say like, oh, it was a traumatic injury, I don't necessarily think that they're all quote unquote traumatic. That's why I say like the tendon damage, the damage that happens to the tendons, whether it's the Achilles tendon, lat tendon, pec tendon, it's typically a problem of the load was greater than the response to the load from your body. So basically what happens is we have this increase of intrinsic tissue damage, and we'll get down to like talking about that's not an absolute injury, but it's more or less a series of injuries that are kind of compiling on top of each other. So the load is basically greater than the response. The increase of the tissue damage eventually reaches a metabolic tipping point, which the demand, so everything we're placing on it, whether it's running, jumping, hopping, skipping, or lifting, is greater than the nutrient supply of the tendon. So it basically runs out of things to use to support whatever we're doing. So that's why I said the ratio is not absolute. Strains are typically not from a single traumatic event. So then we're going to down this is a little bit more in depth, like the kink banding and cyclical loading, but we're just going to like dumb it down as much as possible. When we have like when you're looking at like a subfibril structure of the tendon, so you're not looking at the tendon itself, we're coming down to like small like micro parts of the tendon. What happens is when we originally overload the tendon, we get a little single kink in that fibril structure. As more kinks occur, the collagen, the main supporting part of the tendon, becomes denatured. So it starts breaking down a little bit, we get a little bit more kinks, and it's not as efficient. The further overloading we get, that's when we get these bigger strains, and then eventually maybe like a rupture. But the further overloading we get is you'll lose cohesion of those fibril structures to each other. So the smaller part of the tendon, you're actually losing the cohesion that they're working together, and they become basically like a macro kink. That's when we experience our strain. So we'll go back to talk about like overstimulation, which is pretty much all of this. We're just doing too much over a long period of time, and then in a little bit we'll talk about understimulation. But I want to go back to like the ratio, not absolute. So when we think about ratio, not absolute, like the exact sentence, it's more about what we're doing over a long period of time. So not just in a single day or a single event. It's more about what we're doing over the course of a month or the course of a week, right? So if we have a strict lifting schedule for about a month, and then all of a sudden on one random week or even a random day, we're doing 4, 5, 6 times that amount, that's when we're putting ourselves at prone for these tendon injuries. So I think there was a study done that said basically that on a daily, your tendon can typically, on a typical day, will take up to like a 4% strain. So when you hit that like the injuries occur at around like a 12% strain. So that's when maybe we've seen in the clinic, like someone was had a regular leg day lifting schedule, and then on top of a regular leg day lifting schedule, they randomly one day go out and play basketball for a couple hours. That's when these type of like overload injuries happen. So it's not a single traumatic event, which it seems as though it's a single traumatic event, like, oh, I was just playing basketball and then I felt this. But what really happened is you have this schedule and you randomly throw a way like much greater load on top. So then we'll go back. That's kind of what the general picture of the overloading looks like. And then we'll talk about understimulation. So people come in like, oh, I don't know what happened. I wasn't doing too much. And then all of a sudden I start feeling this pain in my Achilles tendon. I start feeling this pain under my shoulder. We have to understand first that the degradation, so the breakdown or isn't bad. This degradation is actually a big and huge essential part of the tissue remodeling. That's why I think we talked about it before time. I hate when people say like there shouldn't be rest days, because when we're rehabbing tendons, there really should be rest days. What happens is the degradation needs to be, as it breaks down, the rate of degradation is modified by collagen strain. So we need to be straining the tendon and the muscle the appropriate amount, because when it breaks down, that's when it can build back and get stronger, I'll say. When the understimulation becomes a problem is when it's chronic. So when we see that the tissue has been breaking down, we haven't done things for 8, 12 weeks up to a certain level or an expectancy, that's when we'll have like a greater breakdown of the tissue. I think there was a study that said like actually up to 4 weeks, the tissue can pretty much stay the same. So it's after that 4-week mark that if you were continuously not doing anything, that you'll see like that higher load of breakdown. And then when you go back to doing your activities, that's when we might have some of those issues. And that kind of almost ties itself together with the overstimulation. Go from doing it close to nothing to doing a lot. That's when we'll see a bigger breakdown of the tissues. And then loading strategies. So this is kind of just a general, and again, we're going to talk about rehab next time. What we're going to talk about is basically, we'll talk about more specifics, but loading, doing too little, it's going to become pathologic. Doing too much in a short period of time is going to become pathologic. You just have to find that right moderate amount, and we have a little, formula that we'll use to kind of find what is the right amount. So tie this all together is that we didn't talk too much about positional tendons, but in energy storage tendons, basically what we have is, for the most part, it keeps an optimal length-tension relationship. It allows the muscle to basically protect itself. We get the injuries when the load is greater than response to the injuries, and you can get them from basically if you do over or under, you're going to get the same outcome. So it's more about finding that moderate amount and that healthy amount of load for your tendons and for your tissues in order to keep them healthy. Okay, any questions?
My only question would be just how do you find that kind of sweet spot?
Yeah, we'll talk about that next week. But there's a lot of I don't know if you've heard of acute to chronic workload ratio. I've heard something like that. Mm-hmm. We'll talk about that next week. We'll get into it a little deeper, but basically we want to find that 70 tendons respond well to longer holds. So whether it's heavy slow resistance, long eccentrics, isometrics, they respond well to being under tension for about 45 seconds at a time at 70% of 1 rep max. We'll talk about that all the next week about how we can go and find basically the right formulas for each patient, because they're going to be different for everybody, right? So a big thing to remember about the tendon rehab is that there's no cookbook. There's not if you have a tendon injury, there's not going to be anyone that comes in and be okay, it's an Achilles tendon problem, we're going to treat it this way, we're going to do this exercise, because it's in large part attributes to what they're doing, what their goals are, what their sports are, what their loading tasks are, right? A CrossFit athlete that has a tendon problem is going to be a little bit different than if we see a baseball pitcher or a thrower, just because of the injuries, the sport, and what they're getting back to. It's the same as if we find, this is why diagnosis is so important. The same problem presents itself if we have a positional tendon injury as opposed to an energy storage tendon injury, right? Because the positional tendon, and we'll talk about this again next week, the positional tendon strains or injuries we might be at a little bit lower level of a threshold for pain and tolerance to injury as we would for maybe like a lat tendon. We might be able to take one a little bit more. So even like in our baseball throw, it's like we kind of have to really differentiate like what's causing the pain. Is it the lat tendon or is it the subscap tendon? Obviously, you see we have one together that like we know it's subscap tendon. That's why it's gotten better quickly because we provide a little bit of lower stress for maybe a little bit longer of time. Yeah, that's why diagnosis is so important to find out actually which tendon injury is kind of like what's going on.
Okay.
Anything else?
Now, can like a patient or can somebody always like feel the damage? Is there any way that
No.
it can be on the breaking point and they just don't know until it happens?
So you might feel like the irritation in there, and that might be the reason someone would come into physiotherapy. But pain is not always equal to tissue damage, right? So you may not feel it. Somebody that has a high